develop, especially as I meet new people, some of whom I share common interests with, or some of whom entice me to the areas of research interest. Right, so we can start because that's in brief who I am and what my research interests are.
Okay, thank you so much, George. So I'm going to open the floor to you to present, and then I'm going to introduce the next speakers as we go. The next presenter is going to be Columbus, and then Kashyapi is going to be the third speaker. So the floor is all yours, Doc.
Thanks, Kuzi. Perhaps we could move on straight to the next slide. I think those there are my contact details, but I don't think they're terribly important at this stage. We can move on to the next slide. So that there will be part of my presentation, the introduction, the COVID-19 origins and global spread. Then I'll briefly look at discourse in terms of how we define it and its influence on human relations. Then drivers of suspicion during the pandemic and implications for communication or the choice of discourse. And then the social, economic, and political impact of the pandemic as reflected in the discourse of suspicion. And then from there, I will wrap up the presentation. And so by way of introduction, I think many of us agree that the COVID-19 pandemic has had one of the greatest influences on human life in modern history. Was to think of any phenomenon that has had so wide an impact on human life. You tend to have events happening, phenomenon emerging, but in many cases, these affect only certain parts of the globe and do not touch other parts of the globe. But with COVID-19, you do have a situation in which all of us in the world, the whole of humanity has been affected by the pandemic. Perhaps next in comparison to it is just the fourth industrial revolution. And if you look at the two closely, you find that there are aspects of one that you find embedded in the other. But unfortunately, as we speak currently, there are a lot of uncertainties about COVID-19. So, for example, in South Africa, we're talking about the possibilities of a third wave. In terms of remedies, vaccines have come up, but there are arguments and contestations over what works and what doesn't work. So there's a lot of uncertainty around COVID-19. And as a result, if you look closely at how people speak about COVID-19 and the attendant aspects, you will find that the discourse that they use reflects these uncertainties, the contestations, and in some cases, even fear is shown in the way in which practitioners in the media also write and discuss the COVID-19 pandemic. We can move on, Kudzi. So this is partly an indication that we live in a VUCA world that is volatile, in which things are uncertain, things are complex and also ambiguous. So VUCA is an acronym that stands for volatility, uncertainty, complexity, and ambiguity as elements of the world in which we are currently living. So volatility implies that things change very fast, and in many cases, no one seems to have an idea of where we're going, and no one seems to have control over things and how they happen. So you have a virus starting in one city in China, and in a few months you have, for example, that virus affecting someone in a remote rural village, say in Mzarabani in Zimbabwe, or in a very remote township in the Northern Cape in South Africa. And perhaps under normal circumstances, you would have thought before this virus reaches Mzarabani or before it reaches the Northern Cape, surely because of the distance between the origin and where it is now, somebody should have been able to control its spread. But because of volatility that characterizes the VUCA world, some of the things that happen, no one has control. Even the best brains in health sciences, in medicine, in engineering, and even in religion may not have control over some of the things that happen in the VUCA world because of the extent to which they are volatile. And then you also have uncertainty, which implies that we can never absolutely sure what things, we can never be absolutely sure what things will be like tomorrow. So for example, with respect to COVID-19, you can be allowed to work from your office today, but the next day you're told, oh, there's a new strain of the virus, so everyone must stay put, everyone must stay home, stay at home, so you can't come to work. Or today you're allowed to travel to Malawi, but the next day you're told Malawi has closed its borders, and therefore you can't access that geographical space. And even in terms of how we relate, we are told now it's safe for you to hug, it's safe for you to kiss, it's safe for you to shake hands, but within a very short space of time, you're told, oh, that is no longer safe. You cannot do it again because it's now dangerous. So we are never sure what is good for us, what is bad for us, what is risky, what is safe, because of the nature of the world in which we are living. And so you, in such circumstances, you have people then developing a lot of suspicions. You have even experts in certain things that will be happening also not agreeing. And some of them even speak with forked tongues, and you can't understand where exactly they stand in terms of what will be happening. Then complexity refers to or implies that we hardly deal with only one variable, but many at the same time. So, for example, with respect to COVID-19, you're not only dealing with a health issue, you're dealing with a social issue, dealing with an economic issue, and you're dealing with a political issue. And so if you look at the discourse that people use to communicate amongst themselves, discourse used in the media, discourse used by politicians, you will find a reflection of this complexity and sometimes difficulties in terms of the solutions that we can conjure to bring ourselves back to safety. And so in trying to seek solutions, it becomes difficult to decide the point at which we can agree on what needs to be done in order to find solutions or find the remedies that we need. And then ambiguity refers to the fact that nothing is ever clear, because sometimes you have certain things on the surface, what you physically or practically see, what manifests itself on the surface. But this may be different from what lies under the surface. So with COVID-19, for example, up to now, for some people, it is not clear whether we are dealing with an ordinary flu or something that was engineered, something that was made in the lab. Are we dealing with a natural disruptor, or are we looking at something that somebody somewhere thought they could make money out of and deliberately created? So there is lack of clarity. So in terms of its origins and global spread, in a nutshell, the COVID-19 pandemic, first cases of the pandemic were detected in the Chinese city of Wuhan in 2019, then spread to the rest of the world. And it's interesting and ironical that the possibilities that have been availed to humanity by globalization, technological advancements, are partly to blame for the speed at which the virus is spread. So, for example, you have air travel, where you can hop in a matter of hours from one part of the globe to the other. And to give our examples of what happened in South Africa, our first few cases were linked to citizens that had traveled to Italy. And so if you look at the discourse that we use to talk about globalization, the origins of the virus. In some cases, you find elements of suspicion because, for example, people ask the question, is it really true that this disease originated in Wuhan, or perhaps it was manufactured in a lab somewhere in the United States? Nobody is really sure. And then when we move to discourse, briefly, discourse can be described as or defined as language according to how it is used. In other words, we're looking at not just language from a purely linguistic point of view, but from how it is used by those that use it, and especially in terms of the purposes that they want to achieve through use of specific types and elements of language. So when you're looking at a discourse, there are a number of areas that we can focus on. For example, language that naturally occurs, that is used by real users. So for example, people in the media, by health professionals and politicians. And then we also look at larger units of language, more than just the basic grammatical units. So we look at, for example, sentences, paragraphs, and whole texts, whole articles that are used in the media, or whole speeches that are presented by politicians. So, for example, President Cyril Ramaphosa has become popular for the expression "my fellow South Africans." And one looks at it, it is not just a coincidental use of language. Perhaps there is there's a deliberate intention in the choice of that expression to introduce his speeches when he's speaking about COVID-19, perhaps to rally people together. But those on the other side of the political divide might come to the conclusion that, for example, he's just trying to hoodwink us into thinking that perhaps he's patriotic and that the party that he comes from is patriotic in the face of this pandemic that we're facing. And then in looking at discourse, we also look at the functions of language, for example, at the cognitive, at the social, as well as at the cultural level. So cognitively, what are we trying to achieve when we use certain aspects of language? Socially, what are we trying to achieve? And culturally, what are we trying to achieve? So when we're looking at discourse, it is necessary to move from merely analyzing language to which is discourse analysis, to critical discourse analysis in order for us to explore the power relations between the originators of particular text, certain text, written text, spoken text, and the target consumers or receivers of that discourse. Because people don't just use language willy-nilly. In general, people use language to achieve a certain purpose. And one of the purposes that they use language for is to achieve domination, political domination, economic domination, for example, of other groups in society. And this becomes particularly relevant and important, critical, when things are volatile, when they are uncertain, when there's complexity, and when there is ambiguity. And so as students of communication, we should go beyond just receiving information that is carried in certain discourses to an analysis of the relationships between senders and receivers of that information and the power relations that obtain in circumstances where things are not clear. So, for example, we might want to ask with respect to the COVID-19 pandemic, what are the Chinese saying? What are the Americans saying? What are people in Africa saying? And when people in Africa pointed out the fact, for example, that the distance between Wuhan and Beijing is not that long, but look at it, Beijing was not affected by the virus. So that is not just plain use of language. It's not just innocent use of language. It's language characterized, tinged with suspicion in terms of what could have happened, what could have given rise to what could have been responsible for the emergence of the COVID-19 pandemic. And so when we now look at the discourse of suspicion specifically, we can conclude that it arises from the existence of a gap between what is known and what is not known. So there's something, or there's somebody who knows something, the reality, the truth about something, and there's yet another person on the other side who does not know the whole truth about that which is happening. And so when those who know the reality about a particular situation do not communicate the truth, they leave those who are receiving the information that they're communicating about the situation with no option but to be suspicious. But then when those that are responding to the situation are communicating on the basis not of full information, but perhaps half truths, half lies, and what you then have happening, what you then have resulting is the discourse of suspicion. And so in the case of the COVID-19 pandemic, some of the drivers of the suspicion and the discourse associated with it would include the origin of the pandemic, the mere idea that this pandemic originated in China. When you look at China's relations with the rest of the world, with the West, with Africa, and how it is, how Chinese, for example, Chinese practices, Chinese culture, business culture, characterized by people in the West, people in Africa, and people in other parts of the world. You do have suspicion being at the forefront of how then the pandemic is viewed in terms of whether this is a genuine pandemic or something that somebody might have come up. That is why, for example, you might have Donald Trump coming up with such an expression as the Chinese disease to describe the COVID-19 pandemic. He might not have been aware of what his choice of discourse betrayed, but clearly the use of that expression, the use of that phrase betrays suspicion on his part to the effect that he did not trust what the Chinese were saying, for example, that this was just a genuine pandemic, a natural pandemic, and that they tried their best to contain it. And so what you have in the language that is used as a result of the origin of the pandemic is suspicion that characterizes the discourse as a result of the lack of trust between people that are in different parts of the world. But in reality, one can conclude that what is happening here is just a tussle for the exploitation of economic opportunities between different powerhouses, economic powerhouses in the world. And then you also have the conspiracy theories. So, for example, the idea, the notion that the virus was manufactured for a profit motive by the big pharmaceutical companies. And so you look at, there's an article written recently by Arthur Mtambara where he talks about big pharma in order to describe, as he describes these big pharmaceutical companies that he, with a very thin veil, accuses of not wanting to make vaccines available so that they can make huge profits out of this misfortune that we find ourselves in. And then you also have, for example, the Bill Gates video in which he was sort of predicting or advising the world that we needed to be ready for a pandemic of the proportion that, ironically, COVID-19 turned out to be. And then you also have binaries of efficacy, where, for example, we're told vaccines coming from China, inefficient, they don't work, but vaccines coming from the West do work. And then in Africa, our indigenous remedies, your Zumbani, your steaming remedy, those do not work. Madagascar, we were told on social media that they pulled out of the World Health Organization because their remedy had not been accepted by the World Health Organization, at least just for trials. And so you have these divisions, these binaries of efficacy, and in some cases of binaries of what is good for some people in some parts of the world and what is not good for them. And so this would drive suspicion. So if, for example, a small country such as Madagascar comes up with what it calls a solution, or what they think is a solution, and the rest of the world or the World Health Organization says this doesn't work. If I'm in Madagascar, if I'm a citizen of Madagascar, I'm bound to view the World Health Organization with suspicion. And that will be reflected in the discourse that I use to discuss this issue. And then you also have binaries of victimhood. So, for example, the notion that the pandemic only affects people of certain people and not others. In the very first days, so for example, we have the Zim Minister of Defense coming to the conclusion or alleging that the coronavirus was a punishment to the West for imposing sanctions on Zim. And yet these binaries of victimhood turned out, or these conspiracy theories on victimhood, on who was going to be a victim of the virus, turned out not to be true, because we find that most people across different divisions were actually affected: the young, the old, Black people, white people, African people, Europeans, and so on. And then in terms of remedies, like I've already said, you do have contestations, binaries, divisions in terms of what is going to work as a remedy. For example, those remedies that originate from the West versus our local one. So what is considered to be efficacious and communicated as such depends on who is communicating or who is composing the discourse. But in many cases, if you listen to or if you read what people write when they're talking about the other side, you find elements of suspicion about, or suspicions of, the other side in their discourse. And so in terms of the impact of COVID-19, you have several dimensions. For example, at the social level, you do have discourse that is associated with that. For example, phrases such as isolating, such as maintaining physical distance, which perhaps previously had not been commonly used. And then at the economic level, we had a complete halt to production and delivery of services, except for those that were deemed essential. And again, associated with that would be discourse that reflects suspicion. So, for example, if you look at the term lockdown and the different level, you analyze that word closely. It's not exactly a positive word, even though government uses it to flex its muscle and create the impression that it is doing something important to stem the spread of the virus. But then from the side of somebody who has been deprived of their livelihood, the word lockdown simply means you're locking down the country so that I cannot do what I need to do in order for me and my family to survive. And so when people talk about lockdowns, they do not generally speak about them in positive light, because they are associated advantages at an economic level. And then at the political level, the pandemic also provided rich fertile ground for fighting, rich fertile turf for fighting amongst politicians, those on the opposite side of the political divide in many countries. So you had accusations being traded. For example, in the United States of America, some scholars believe that besides other factors, the reason why Donald Trump lost the election was because of his approach to COVID-19. In a country such as South Africa, you have the opposition, the EFF, for example, blaming the government for not doing enough in order to stop the spread of the virus and to save the lives of the citizens. And so you have in one video that circulated on social media, for example, Julius Malema, the commander-in-chief of the EFF, saying the government had no plan at all, and going as far as to say that they were really pathetic in their approach to to the COVID-19 pandemic. And so you do have suspicions there, elements of suspicion in how COVID-19 created tensions between or amongst different political players. So in conclusion, I would like to submit that the VUCA world is difficult to navigate, both in terms of what happens in it and the discourses that are used to communicate events that take place in it. But then, so the road that links suppositions, guesswork, and assumptions on one end, and reality on the other is often very murky and impassable. It's not clear. And if you wanted to navigate it so that you can get to reality, you might find yourself stuck at one point, and you might not be able to get there. Therefore, as students of communication, we need effective tools that help us to navigate that road. And in my view, one of those tools is effective research on our part, a questioning mind, an interrogative mind, an inquisitive mind that seeks to establish whether what we are being told is really true, whether what we're being told has been verified or not, or we're just being told something in order to set up an agenda for the originator of the communication, the discourse that we are getting. Thanks, ladies and gentlemen. That brings to an end my presentation. Thanks, Kudzi.
Thank you so much, George, for that. Thank you so much, Doc, for that concise presentation. I think all of you would agree with me that it was also very accessible and easy to follow. So if anyone has questions, please just take note of them. We're going to be taking questions when we do our once-off Q&A. So next, we're going to have a presentation by Columbus Mavhunga. Columbus is a Harare-based freelance journalist for VOA, CNN, Deutsche Welle, and Deutsche Presse Agentur, and he has been a journalist since 2000. He studied mass communication at the Harare Polytechnic College before enrolling for a marketing and communications degree with the University of South Africa. And Columbus has a very great outline of work, great catalog, and I was very much also very interested in the journalist stories and your experiences of practicing journalism during COVID-19 in Zimbabwe. So Columbus, you can take the floor. Thank you for agreeing to do this.
Thank you, Kudzaiishe, and also thank you to Dr. Mavhunga. I hope to interact and everyone else who is part of us. I was really interested in his that's Dr. Mavhunga's presentation. It had some notes that I had in my presentation, which serves me right. It's always better to be led by someone who knows better. So I'll skip most of what he had said, especially about the word lockdown. I really wanted to talk about it and also even interrogate him being an academic. But anyway, back to what I'm supposed to be talking about. I think I'll just start by an overview of how things started in Southern Africa. I think when COVID-19 was raging havoc, especially in Italy, America, United Kingdom, and China, this part of the world, we thought, I think it was just something which was a flu which was passing by, and maybe it would come here as something which would not be as catastrophic as it has turned out to be. And for us in Zimbabwe, I think we had our first case on the 23rd of March last year. How time flies. Since then, I think we have had so many people who have lost their lives, and they've been lost their lives, and also some have been infected and affected. So when it started, we, as media here in Zimbabwe, most of us, and I'll speak about myself, we didn't know much, and I would not give much, fear to like close spaces, the issue of face masks and so on and so on. So when it came, we were thrown into the deep end, and we were expected to just swim back to the shores. We didn't know exactly what we were reporting on, whether it was a war between the West and the East, that's the China and the West. We didn't know exactly what we were reporting about. And then when it came home in Zimbabwe, our first case was in Victoria Falls. I'm sure most of us would know. That's where we had our first case when it was reported by then Minister of Health, Obadiah Moyo. Before that, he had said, we're 100% prepared, and I had to do that story. People didn't like that story, but I said, no, he says we are 100% prepared, but then people challenged him to say we had Stone Age diseases like cholera, we have typhoid, we have people who have got to hospitals that don't have painkillers, but you're saying you're prepared for a pandemic that is causing a lot of deaths in more developed countries with a functional public health system. Here, we don't have anything, but you still say we are 100% ready for it. People, I talked to colleagues, they were against the idea of us reporting on that story. And I think that was one of my first stories, that Zimbabwe is 100% ready for COVID-19. Then I think WHO came in and said, they gave me a quote, and then I asked the others, critics, to come in, and then I did my story, and then after that, here we are, more than a year down the line, we are still reporting on it. So it started as trial and error, and we had limited resources. That's to exactly what we are reporting on. Would just depend on what experts say. If someone from WHO says something, then it becomes a fact. If someone from the government says something, then it becomes a fact, although some of it would be obviously a lie, like the example that I was giving of Zimbabwe being ready for COVID-19. So we were risking ourselves to jumping into lies. We're also risking ourselves by just ignoring the protocols that were being called to observe. For example, social distancing, being in close, avoiding closed spaces, yeah, we were ignoring that. And I would say, I think with hindsight, I think, yeah, it's lucky that some of us were still going on, and I've not had the disease. God forbid, I don't want it. But said to say that we have lost at least three journalists that have officially been declared as what mean, no? We have three journalists that we have lost due to COVID-19, including the Secretary General of the Zimbabwe Union of Journalists. So I was just talking about that challenge of not having resources, whether information resources and also PPEs. So then, as we were going down, the organizations, when we started having journalists being affected and more infections in Zimbabwe, then editors in Zimbabwe then started scaling down. People were then being asked to go and work home. And that came with limited resources as well, because data services in Zimbabwe, I think in Southern Africa, after Zambia, I think we should be the second. So there wasn't enough support for those who are now working from their homes. But for me, I think I would say I should make a disclaimer that there wasn't much of a change, because I'm a freelance journalist. So either if I'm operating from an office that I have in town, or if I'm operating from here at home, it was almost the same. Only that I have an army that I stay with my kids, and they're always a problem. Then related to us not knowing exactly what to do, we were going for high spread events like press conferences or anything that would come by, because government and most institutions here were taking time to respond or to release news. So we then just said, okay, we'll go for it, and would expose ourselves to the pandemic. And then there's another angle that I would want to bring in about how the government reacted generally to what it called fake news, and how the social media and the media would work. They introduced in early March, that should be early March, they introduced what they call peddling fake news about COVID, and you risk being in jail for that up to 10 years if you are convicted. I think we are not alone though in that case. I think it was only Botswana and Namibia which did not declare which did not declare state of emergencies. So we are still in a state of emergency, but though I think the levels have gone up and down, we are fairly now almost back to normal, though we still have the issue of mask and all other WHO protocols to follow. So when the issue of fake news came, then the government, sort of the police mainly, to be honest, they sort of tightened how we operated, how journalists would be operating. And I think between the beginning of April last year to about mid, there were a number of harassments, journalists being attacked, or being stopped to work, or being arrested. That led to the Media Institute of Southern Africa, MISA, going to court to interdict that. And ironically, it happened on Zimbabwe's Independence Day on the 18th of April, to stop police from harassing the journalists, because when the lockdown started, the government did not categorize the media as part of the essential services. So the police were saying, where are you going? Stay at home. Everyone, you are just anybody else, unless if you're in uniform or in essential services, which we were not, of course. So the police was just following the law, but that was unconstitutional. They were following the lockdown law, which was a bit unconstitutional. So eventually the High Court then said, no, the media is essential. And I would give the credit to the government. It did not object to that. They said it was an oversight on their part, and we were then allowed to operate freely. But we had borne the brand of pressure to release news at the expense or risk of being arrested by the police. After that had happened, though, we still had cases of harassments of journalists. I think what comes to mind, I'll not talk about an obvious case, which many people would know about, of Hopo Chingono, who was arrested 3 times for mostly breaking the lockdown regulations. And the other one, I think it was they did not mention it directly, because they were saying he had quoted someone talking about a child that had been killed, and then the story was on social media, and he retweeted that, and then the police pounced on him, and then he was arrested. But there is another case of Mududis Matutu, an editor of an online Zim Live, which had reported about PPEs, corruption in the procurement of PPEs in Zimbabwe. So when they were looking for him, they went to his home, which is Mlawa, Zimbabwe's second largest city. They went to his home. They couldn't find him because he had been tipped that they were after him by fellow Zimbabweans. And then they went for his nephew, and his nephew was kidnapped, we are told, and went missing for some days. Eventually, he appeared, and there was a video that came out. Apparently, the nephew is a journalism student, so they were trying to use him as a bait so that the editor of the Zim Live can come out in open and get arrested. But he was up to now, he has not been arrested. But I think the fears of him being arrested are there, and the Media Institute of Southern Africa and the Union of Journalists are monitoring the situation, hoping that he remains free, or at least the police declare that he is no longer on wanted list. Related to that, there's a point I had to remove the lockdown issue after Dr. Mavhunga talked about it. But I think I just wanted to talk about what he said about lockdown. The word sounds very nice, at least from when I first heard about it happening. Was it in Italy when one of the CNN producers had been locked down there and couldn't get out of his space to fly out, fearing that the lockdown would prolong. Human rights organizations, including the media organizations, they've been saying, I think the government has been coming hard and capitalizing on the lockdown and the state of emergency to contain the coronavirus, and they're saying they are riding on what they used to be before. I don't know whether that's true or not. That's up to the jury. But the story is, or what is being said is that the lockdown is being used to curtail the freedoms of the people. And I remember when Kudzaiishe was talking to me, he introduced the story that one of the stories that I did about the United Nations Human Rights Office being concerned about a human rights report which had been which was talking about I'll just pull it out. Okay. Okay, the story, the intro says the UN Rights Office says it is concerned by a UN Human Rights Watch report that says Zimbabwe's government is using the COVID-19 pandemic as a pretext to claim down on freedom of expression and freedom of peaceful assembly. Yeah. So this has been very topical, I think, over the last 12 months, that people are not free to do what they want. You'd know that we are largely an informal sector, and people would want to go about doing their business. So if you're saying we are in a lockdown, so you can't go and sell your tomatoes outside the gate, so that at least you have money for bread, how do you go about it? And also we had cases of 3 female opposition activists who have been arrested. I think for the 3rd time now. They're still in prison. Well, for the 3rd time, they've been granted bail twice. Now they were arrested again for flouting the lockdown regulations. Initially, they had protested against government's failure to provide payments for those who are unemployed, who are like the people who are informally employed, who were not having any payments, but they were being asked to stay at home. So when the human rights report came out, and then I saw the comment from the United Nations Human Rights Office, and they came out with it. A number of colleagues were saying, aren't you afraid of yourself? Because then I said, no, well, I don't know what to do. If I'm to be afraid, then I won't do anything. If I'm to be afraid, I won't do anything. If I'm not, then I'll do something. So which I did. Luckily, I should say, no one from the government has ever raised any concern about the story. Hopefully, they are not concerned about it, or they are just monitoring. Yeah, I think basically that's what I wanted to say. What else was some of the stuff I had removed it as Dr. Mavhunga was speaking. I think so that's it. Sorry, I'm not as organized as an academic. The one who spoke ahead of me. I'm mainly for listening and not for talking. So that's where we have the difference. I think that's about it from my side. I was also wrestling against time because I didn't know what my connection would do. It collapsed twice when the doctor was speaking. So I'll be happy to take any questions, should there be any at the end.
Okay, thank you so much, Columbus, for that great presentation, and also for the courage and the allowing us to sort of like hear your experiences, and some of which to some extent sound like really to some extent traumatic. But thank you so much for sharing it. And just to give you a note that your presentation skills are great, and we really followed well. And also academics are not the most organized people as well. So I really appreciate that. Thank you. So questions are going to be noted and jotted, and then we're going to have a Q&A. We just have one more presentation, last but not least, from Kashyapi Ghosh, who is a PhD scholar at Indian Institute of Technology, Tirupathi, working in the area of gender studies. For her doctoral thesis, she's looking at the changing dynamics of the kitchen space in India through visual culture. And apart from her research area, she's interested in food studies, sociology, memory studies, and cultural studies. And Kashyapi is going to be presenting around the coronavirus and the hermeneutics of suspicion. And then she sent me this abstract, which I'm going to read, which says, in and around March 2020, human life changed. The novel coronavirus and its highly contagious nature changed the world around us phenomenally. Masks, sanitizers, contact tracing, lockdown, isolation created a narrative of panic and suspicion. Suspicion percolated at multiple levels, at the individual level, at the community level, and at the state level. The lecture would, the presentation would take into account all of these levels from the Indian subcontinent viewpoint, and how suspicion altered the idea of normalcy and threw us into a new normal, where every touch point, every known or unknown human being, and the state is a metaphor of suspicion. All activities previously deemed normal are tantamount to a certain amount of skepticism. I borrow the term, she borrows the term hermeneutics of suspicion from Paul Ricoeur and Hans Greg Gadamer to understand the fabric of suspicion that unfolds as we battle the unknown mutating virus, creating havoc across the world. Thank you, once again, Kashyapi, for agreeing to do this. And I'm introducing you now to the colleagues and allowing you to take the floor.
Thank you so much. Thank you, Kudzaiishe. So before I begin my presentation, I would apologize because I might have to switch off my video because of bandwidth issues. And I would like to thank Dr. Shayande and Kudzaiishe Vanyoro for inviting me at this WiCDS Diversity Studies Center. And I'm immensely happy to be a part of this platform where I can engage with such stalwarts who have spoken before me. And I think most of the things have it is common to the countries. So I'll be speaking more from the Indian point of view, that how we had it in India, like we had heard from the others, from Zimbabwe, from South Africa. So mostly it would be about the Indian subcontinent and how we process the pandemic and still processing, and how it created different levels of suspicion. So thank you everyone who has made it a point to attend this. I'll just begin. The novel coronavirus, actually COVID-19, entered our lives all of a sudden, and it changed the kind of fabric of normal life, leading to a cessation of everything previously considered normal. So before I again begin, I'll just say that I do not have a slide, but in between I would be sharing snippets from the print media, from leading newspapers in India. So on and about December 1910, human nature changed. All humans' relations shifted. So writes Virginia Woolf in Mr. Bennett and Mrs. Brown. And similarly, in such a similar way, around March 2020, human nature changed once again when the virus hit the world and created a new term and what we can now call the biomedical crisis. The virus, which allegedly spread from a wet market in Wuhan, has since then led to the promotion, acceptance, and creation of multiple conspiracy theories, which Dr. George and Columbus both talked about, and how the idea of a conspiracy theory became coterminous with the origin of the virus. The rumor of whether it is lab-made or whether it is a natural occurrence were backed by the international media. So we had a lot of theories, overnight theories, right, left, center, everywhere, and then there were stalwarts. I remember a French Nobel laureate, Luc Montagnier, made explosive kind of revelations where he talks about that it's definitely genetically engineered, and it is not something that could have risen naturally. Uh, Again, we have the USA President, Mr. Donald Trump, who actually went out and he said that it is the Chinese virus creating multiple discourses of racism, and that, and everyone had like innumerable unanswered questions in their minds. The entire scenario was that of suspicion, where no one knew the origin, the cause, and the effect of such a virus. A number of words just got added and renewed in our vocabulary. So we had words like quarantine, self-isolation, herd immunity, lockdown, all thrown in, so on and so forth. The rapid global spread of COVID-19 has been accompanied by what the World Health Organization, again, a very controversial organization right from when the pandemic started. So has described it as a massive infodemic. It's like the word infodemic almost like in coterminous with the epidemic, that where there is an implosion of information barging into our lives through media, through word of mouth, through different kinds of websites. And through, even we had in India, we had live interactions with doctors who were answering our queries, who were telling us, you should drink turmeric with milk, or certain kind of home remedies which were continuously given out, but no one actually knew what works and what doesn't. So Jean Baudrillard, French sociologist, a philosopher, describes the media as a speech without response. So there is this, again, through the media, there's a creation of this rhetoric, a one-way communication where we are at the receiving end of too much information. Most of it is unprocessed and full of medical jargon. You have mRNA, DNA, and genome. We have plasma therapy, and so on and so forth. Incomprehensible to the common man. It is found that as a result of the pandemic, 67% of those surveyed are watching more news coverage than that, and half of that subset are spending significantly more time in doing so. The overconsumption of the news feed causes a natural instinct of mistrust and suspicion. So the more you read, the more you understand that I don't know what to believe. I don't know whether this news channel is showing the correct facts, or that news channel is showing, or that particular website is giving the correct information. But the idea remains is to herd more information about the statistics, symptoms, cure, caregiving, and other health anomalies of the disease that the world is grappling to come to terms with. Following up on all this over information, a narrative of suspicion is created, wherein all you have read, you have understood, or you have emulated stands like a question owing to the novelty of the problem. So we are in the midst of an unprecedented problem that hasn't been there before. So there is no literature where we can go back to and see that, okay, why is this happening? So there are no straightforward answers, but a whole subset of new questions that are alarming. We have symptomatic, asymptomatic comorbidity due to this highly contagious nature of the virus, narratives of suspicion spread at multiple levels. Now, India, when I was told to speak about this, I wanted specifically to talk about India because most of it, being an Indian, I'm more aware of the situation here rather than on a global view. I would be better able to give a view here. So India is a country that is known for its diversity, among other things, and its exploding population. Standing at an alarming population, the novel coronavirus created a new problem to the already existing one. So we have already problems of housing, of healthcare facilities. The problem of containing the virus and breaking the chain, and more importantly, the problem of social distancing. I think anybody who is aware of the kind of population we had would know that how difficult it is to distance people in local trains, in buses, in public commutes, especially. Within a span of few days, the dynamics changed. The Prime Minister of India declared a nationwide lockdown or shutdown. I think lockdown is the word of 2020, so there's no doing away with that. So there's a suspension of all kinds of activities with respect to work, socializing, travel, and everything changed overnight from normal to emergency, creating a suspicion about the origin and the nature of the virus that disrupted lives and threw everything into a state of uncertainty. So such suspicion, I have to look up suspicion that how and what levels I'm going to talk about. So suspicion, according to the Merriam-Webster dictionary, is the act of suspecting wrong based on the slightest evidence without proof. So the idea of suspicion stood at the center of this pandemic, and people from all sectors, organized, inorganized, formal, informal, everybody was hit at some or the other level, some economically, some mentally, and again, various others were physically hit as well. So I borrowed this term, hermeneutics of suspicion, from Paul Ricoeur, and where Paul Ricoeur actually talks about he talks about masters of suspicion, and he mentions Nietzsche, he mentions Marx and Freud, and how they have changed the way we read texts of any kind. So here I would use the term hermeneutics of suspicion to understand that how this same framework can be used to identify and interpret how suspicion is read within the activities of the state and the community. The interpretation of such a suspicion is almost like reading a text with endless connotations. So we don't know how many, at what levels it works. I'm just taking 2 levels, but there are so many sub layers to how it is working at the level of the society. And so I will read into this through different levels in the Indian subcontinent with the help of snippets, like I mentioned, from the print media. First in the state level and then at the community level. So now I'll start sharing my screen. Yeah, is it visible?
Yes, we can see it.
Yeah, okay. So it's like I said, it's about the 2 levels. First, at the state level, where actions taken by the state, certain necessary or unnecessary, because the nature of the virus is such we do not understand which is necessary and which is unnecessary, which creates mistrust among the people, among the citizens. And second, at the community level, how do we react to such a virus, and how our activities create that narrative of suspicion. So first, at the state level, I would quote Morton Deutsche. He said, "The significance of the phenomena of trust and suspicion in human life is attested to not only by past preoccupations, but also by current concerns." So it's not more about the past, but about the current concern of the pandemic is of paramount importance to the world at large. But within the greater concern of the pandemic remains the restriction of mobility and imposition of a variegated set of rules from the state, wherein suspicion gets reinforced. So in India, the gravity of the situation was realized at an advanced stage. So I think very early on, there were some steps that necessary / unnecessary steps that were taken, and the information disseminated was seen with varying degrees of suspicion. So here you can see there are certain things that this is a very recent one, where again we have suspicion even now, even after 1 year of the pandemic, where there is no consistency in deciding on containment zones. And second is the idea of migrant workers. So India had a very big migrant worker crisis where people had to travel, they were walking, and there was this whole crisis where there was no transport, but people had to come back to the safety of their homes because of the sudden announcement of the lockdown. So this non-consistency in containment zones was also a problem 1 year back, where we had different kind of zones: red zones, yellow zones, green zones, where in red zones mobility was restricted, in green zones people could somewhat move. So there was these kind of binaries, or what do you say, divisions, where people, where there was a lot of suspicion from the citizens. They didn't know, oh, what is all this kind of management or this jargon related to the virus. So people again went helter-skelter trying to get back to the safety of their homes. The ideological state apparatus forced people to follow rules with the deployment of police forces, and thereby creation of suspicion in people's minds. So people were fined for not wearing masks. Some were picked up because they were primary contacts. Some you couldn't, if there is a big queue and you're not following social distancing norms, so there would be police forces deployed to take care of the situation. There is a whole machinery in action that tracks movements, take notes of boarding and destination points, conduct thermal screening. So now everywhere we have a thermal screening before we enter, but not always we know that, okay, what is it happening? Why are our addresses being noted? So every time you enter the railway station or the airport, your name, phone number, your address is registered and kept for the record. At such a juncture, the mistrust develops and interferes with regular life. The government and its policies are seen with displeasure. So they have an epidemic act whereby if you don't follow rules, they'll pick you up, they'll harass you. So nobody knows that what is going on, because we are in the midst of an unforeseen situation, and governance in itself is a trial and error. Like Columbus mentioned before, that everything that we are doing is a trial and error. If this doesn't work, we try something else. There is no rule book, no fixture, no timeline as to when this mayhem will end. It is almost like the media ontological succession, which Boris Gray talks about in his Under Suspicion phenomenology of media, where one feels secretly observed and followed from the media space. This is the same thing that happens with the government, and how the citizen is always under the impression that he or she is being observed from unknown, unidentified sources, like almost the Foucauldian panopticon, where you don't know whether we are being observed, but yes, you are being observed, and at least you are being made to feel that you are being observed. And like that, Big Brother is always watching. So I will now provide a few examples to elucidate how suspicion spread from the state level. And so here you see the PM announced within a notice of, I think, 2 days, as far as I remember, he announced a 21-day lockdown. And I remember we were at the institute, and suddenly we had to go, we pack our bags, and we just thought we'd be there for 2 weeks or so, and 3 weeks precisely. But it ended up being I was there at home for almost 11 months. So here he talks about how he wants to implement, and as you can see, there's a Devanagari script where he has written Corona, and he has individually broken it down into nobody should be on the road, and that's written in the Devanagari script. That's Hindi, one of the languages of India. So now I'd move to the examples. So one of the examples was contact tracing. Contact tracing was considered an important mechanism of containing the virus. In this mechanism, people who have been in close proximity with an infected person are traced and put in isolation or quarantine. This involves the reiteration of suspicion and self-doubt among the citizens of a state when they are randomly called or picked up for testing. Sudden visits are there by health officials, and that creates an air of mystery, because your neighbors come to know that somebody tested positive. And there's this whole aura of suspicious activities, and everything is done in a hush-hush manner. People who test positive, they don't want to come out and say that, okay, we tested positive. So everything is so unknown that there is a whole lot of mistrust around it. Imposition of fine for not wearing masks or violation of social distancing norms remain another aspect of suspicion, where citizens have a vague picture of the contagious nature of the virus, but they are expected to follow the rules without fail, without even almost questioning. Now the barricading of containment zones. So containment zones, like I mentioned before, it's like one or two members of a family are affected by the disease, so they are isolated from the rest of the neighborhood to prevent the virus from spreading. So this concern spreads an eerie sense of suspicion towards the ordinary citizen who is expected to adhere to the ever-changing rules and regulations imposed by the government. So one day something is a containment zone, the other it's a free zone. So it's always changing. There is no fixed set of rules. So today there's a lockdown, tomorrow there's a night curfew, something like that. Social exclusion is a theoretical construct, a lens through which people look at reality rather than reality itself. So at such a juncture, laymen do not have any means of experiencing reality. So they just look at reality like something very objectively and according to the state. With the advancement of technology, software applications have really taken over our lives, from sleep tracker to fitness measurement to step tracking to food delivery. Everything is at our fingertips. But with the ongoing pandemic, a new kind of application was created in India by the National Informatics Center to track an individual's movement to gain information about the susceptibility to the virus and his or her travel. So we have this. So we have this Arogya Setu app in India where patients are tracked, or anywhere that you go, whether you're in the airport or the railway station, you're supposed to have this app, and people come and check whether you have the app on the phone. But as you can see that there is no information on where the data is being stored or how it is being utilized and how it is going to change, and who will get access to all that data when the crisis is over, or where is the safety of the data. So none of it is known. Again, it's a big question and a big concern of suspicion. Newspapers become the propaganda model and of the state to manipulate facts and figures. So we have so many websites. I think we have the Worldometer where there are so many numbers. We have COVID-19 trackers. So they manipulate and figures about ongoing procedures of the pandemic. This increased the suspicion in people's minds. The relentless coverage of an increasing number of infections, deaths, and the impending doom, it increases the suspicion definitely about the reality of the situation. So I think there was a time when all of us were really interested in the number of active cases, the number of recovered cases, deaths. So there is this is a vicious chain. So citizens have a lack of faith in the machinery that forces them into believing such fragmented pieces of information. So the second example I would go after the contact tracing is the vaccination drives. Earlier this year, the vaccination drives were rolled out in phases, but it opened up discourses of suspicion again with regard to its effectiveness, to whether it has any side effects or not. So two vaccines we have in India right now: the Covishield, which is again the AstraZeneca model, and the Covaxin, which was manufactured by Bharat Biotech in India. But there was a certain amount of duality, and experts believe that it was not, it didn't undergo enough trials before being administered, and there were dualities whether it is more effective or whether it will stop the contagion or whether it will help prevent the spread of the virus. So there were no definite answers were given, and the vaccines were administered on a priority basis to frontline warriors, doctors, senior citizens, etc. It goes without saying that the pandemic crisis has given rise to problems in almost all sectors, and there are no definite answers to any of these problems. So in such a scenario, what we can do is, as humans, we are forced to consume so much of information with a lot of mistrust. We don't really understand what we consume, but we don't know anything. So it's like you need that piece of information to kind of comprehend maybe a percent of it. When this will end is now $1 million question, but the suspicions are even more with respect to the nature of the virus and how it affects day-to-day living. Now I will move to the second part where I'll be talking about the community level. So as you can see, in the community level, I have taken out snippets from major newspapers, so there's from Hindu, from Indian Express, where first is new Muslim man brutally trashed on suspicion of spreading coronavirus, and then man beaten, told to leave. So these are just like a minuscule a drop in the vast ocean. So there were many cases of people being victimized just on the basis of suspicion. So there were people who were thrown out of their houses. There were people who were socially boycotted because they had contracted the virus, or allegedly they had contracted the virus. No one knew whether they had actually. So I would quote Kingsley Davis when he says that community is the smallest territorial group that can embrace all aspects of social life. So when we talk about embracing all aspects of social life, there is these incidents that kind of make us question such kind of definitions, where the pandemic showed us the two kinds of the community life. First, a group of healthcare professionals, emergency service providers, who embraced the hurdles of the pandemic to enable a smooth functioning of all associated services. Second, there was a group of uninformed or semi-informed, you can say, who disrupted the essential definition of community life. So community life has been declared an essential to combating the pandemic by experts. But when you see such news about the community, you're really suspicious as whether as we have failed as human beings, or whether we have the entire crux of community life has been disjointed. Mutual aid groups and community charity drives have provided for multiple families during the pandemic in India. Due to the lack of employment and a stable source of income, families were in absolute poverty in India. So we had so many drives. I think in the community level, people gathered. They took rice, the essentials, daily essentials, and they gave to people who couldn't afford it at that time. And community aids helped them survive the pandemic. However, the other aspect of community life is an ugly truth which defaces the cruelty of modern life. Suspicion trickles down at the community level from a variety of sources, like you have word of mouth, so the rumor mills are there, fake information spread by different forms of the media. So we had a news like a Muslim man was actually selling fruits, and he was leaking them in order to spread the virus. But these are all misinformation being spread at the cost of a community. So, however, in the pandemic scenario, things took an enigmatic turn and suspicion increased among community members, hampering the general note of unity. So there was a general feeling of unity which was hampered because of these kind of repeated incidents. So there were some contemporary incidents that I will share, and how suspicion became one of the primary problems at the community level and the repercussions it had on collective survival during the pandemic. So yeah, in a sudden turn of events, immediately after the announcement of lockdown, there was a mad rush of hoarding essential items. And one such rumor mill made people hoard essential items much more than required. People regularly used to go to the supermarkets, and hoard only for the families. So there was no concern whether the other person is going to get their groceries or not. It's just this feeling that you will die of a food shortage that kept them doing this. So it created a gap in supply chain, and there was an unequal distribution of resources. The supermarket shelves would dry as soon as they were stocked up. Inventories, so there was a person from the supermarket who said that inventories that were supposed to last for a month were actually gone within weeks, and thereby the supermarket started regulating the amount of grocery you can purchase. And so that kind of prevented people from, holding sanitizers and hand washes and all the essentials. So at some point, I think sanitizer prices increased. People started making, I think in my institute in the chemistry department, they made sanitizers, distributed it to people because it was becoming such an expensive affair because of this demand supply inequality. Another ugly level of suspicion was the pelting incident of doctors, nurses, and other healthcare officials. People who were continuously living at the edges on bare minimums, 24/7. They were wearing PPE kits. They were giving critical care to patients of different severities. Were attacked on the basis of the suspicion that they would be harbingers of doom and disease in the residential colony. This incident was reported in the Indian state of Madhya Pradesh. I think the city would be Indore, and where residents attacked doctors and nurses with stones to forbid them from entering the neighborhood. Such incidents force us to reanalyze and problematize the role that suspicion plays and how it brings out the notorious side of human nature. So another heart-wrenching incident that happened was that how there were certain seeds of suspicion that led humans to behave in a most peculiar way, like showing there was no sense, no common sense behind those incidents, and a lack of in-depth understanding about the disease, in fact, dehumanizes people and degrades their innate humanity. So around June.
Kashyapi, can I give you two more minutes to wrap up?
Yeah, sure. So there were certain, when the number of cases were increasing sporadically, so there was a guy in Surat who was beaten because he was supposed to be infected. Then we had the major incident of the Tablighi Jamaat in Nizamuddin Markaz, where Muslims were blamed all over the country for spreading the virus. So, and then again, we have the Northeast citizens who were harassed, and there was a woman from Manipur in DU campus, in the Delhi University campus. She was spat on, and people called Corona chinky, these kind of things. They forced us to reanalyze the essence of community life and how suspicion has changed the fabric of it. So suspicion does not just ruin traditional foundations, but also replaces them with new foundations. In India, the ongoing pandemic has ruined the age-old foundations of trust, codependency, and community living to create an environment of mistrust, where every news, every human being, every touch, every namaste, and every handshake is looked at with some degree of suspicion. The contagious nature of the virus has changed the way we look at both at social gatherings and festivals. So Holi, Diwali, where we all celebrate together, has all been marred by the virus and the ensuing suspicion. As Boris Groys says, that every suspicion is also simultaneously awaiting for revelation. The suspicion around the novel coronavirus is also waiting for the contagion to cease and the world to regain its normalcy in the truest sense. The revelation, whether good or bad, is again a looming question as we move from first wave to second wave, and I don't know how many waves to come. The ideal revelation would be that of a corona-free world devoid of masks, sanitizers, disinfectants, RT-PCR tests, and the restoration of the world order and unity. Thank you so much.
Thank you so much for that presentation, Kashyapi, and also just giving us a different context, because I understand that two of the first presentations are very much Southern African oriented, and also it just gives clarity as to the fact that some of these problems or some of these issues around suspicion take very to some extent some similar patterns across the different regions that are represented in these presentations. Before I open the floor for questions and answers, and I know that there's going to be a lot of those, I'm just going to give also some brief reflections on interesting things that I've really found interesting. So from George's presentation, I really picked and liked the idea of the binaries of efficacy. and how that's something that can be, that we can also think about in terms of people's suggestions for solutions and whose solution is rendered legitimate. I also picked from Columba's presentation how tourism, the tourism sector, or to some extent movement and migration became a hotspot of suspicion, and those who had moved from certain areas were regarded as carriers of the virus. Also, what you also brought that really got me concerned, but also excited, was also Columba's, the issue around the Zimbabwean government's suspicion of journalists and the conduct of journalism, and also how lockdown was, like you emphasized, was also being used in Zimbabwe for purposes of political clampdown. But again, the suspicion that was also attached to that. And from Kashyapi's presentation, I also liked how you spoke about contact tracing and quarantine, and how that is all in its own a ball game of suspicion, and also the sort of suspicion around the potential manipulation of figures that was part of what was happening in India. Also, the story around the man was trashed for spreading COVID-19 also resonated well with the experiences here in South Africa, because I remember at some point there was a certain man from Limpopo who was accused by the community for spreading the virus, and a lot of people in the community suggested that he be arrested for intentionally spreading it. And we can also, I can also relate by saying that when the virus started, there was also sort of this suspicion towards a cough, and as you mentioned in your conclusion, Kashyapi, that even greetings themselves have come to be viewed with suspicion. And just the final thought, I want us to also reflect as we go with the questions and answer about how suspicion should be considered as something that is that was very essential to people's perceptions, or the public's perceptions, of what the government would consider essential packages or essential goods, and from whose point of view were those goods being considered essential. Was certain type of medical care considered essential or not? And also, when it comes to the case of South Africa, the suspicion that arose from the government relief packages, and also the accommodation and sheltering of homeless people, but also homeless queer communities, for example, in parts of Cape Town. Before I open the floor for questions, I'm going to read in the chat where there's been great engagement while the presentations have been going on. And the first part comment came from Cuthbert, who says, should conspiracy theory not be included among the associated discourse related to COVID-19? I understand that unlike the other terms, conspiracy theory has a longer use. However, the way it has become popular, often as a way to silence alternative views on COVID-19, deserves mention, especially in view of the fact that dominant science or medical discourse on COVID-19 has often been contradictory, changes, and is not monolithic. George also affirmed that, Dr. Mavhunga also affirmed that view, which is also a very important perspective. Thanks for that, Cuthbert. And then there's also a second question coming from Maria Mutibang, which says, how important is consistency in the content of communication in decreasing suspicion? For example, a good case study of misinformation about wrapping, sealing COVID-19 corpses, the mystery about the procurement of vaccines, etc. Who was the spokesperson for the country on COVID-19? And then I see that there's a response from George who says consistency should be key in crisis in order to minimize suspicion. However, it is difficult to attain when there are knowledge gaps, especially on the part of people who should know better. For example, medical practitioners. It gives an example of how in the 90s, corpses of HIV/AIDS victims were wrapped or sealed to prevent the quote-unquote transmission of the virus. So thank you for those questions and engagements, that those have been noted. I see a hand from Shayun. You want to ask a question, you can go ahead.
Thank you so much, Kudzi, and first of all the speakers for their fascinating dimensions of their thoughts. I was just wondering to share that just one particular question. Am I audible? Oh, great, great. Yeah, I was just wondering to share a question. While I was listening to all the three speakers, bringing in the dimension of conspiracy as well as suspicion together, which is obviously a very important intersection which goes in hand by hand. I was just wondering that we obviously through different researchers, through different kinds of activities that are taking place around, we are very much aware, or if not very much, at least to some extent, we are aware the agencies, about the physically appearing agencies who contribute towards this conspiracy and suspicion at the same time. But what about those agencies which are not visible to us, or which we are not aware of it, and which actually actively or passively contributes towards these creation of this kind of suspicions or conspiracies? But when we investigate the problem, when we investigate the issue, they do not appear in front of us. They work silently from behind. And this is sometimes what makes the person who is speaking against such kind of violence a contributor into the violence, whether consciously or unconsciously into that act. So I mean, it's not exactly a question, but it's like invitation to all the speakers and all the other people to maybe think about, or also may share some of their thoughts, that how to address those invisible agencies who contribute to this kind of conspiracies, who contribute to this kind of suspicions on a daily basis. So I was just thinking of sharing this particular aspect with all of you. Thank you.
Thank you for that, Doc. That's a very important question. I'm going to just put it to the panelists to note that question. Maybe we have space for one more question before the panel can respond. Okay, so maybe I'll put it to the panelists to reflect and maybe not necessarily answer, but to kind of try and reflect on what that question / comment from Sayun means for COVID-19 and suspicion, and from the different areas that you are coming from. Kashyapi, would you be willing to respond to that? Okay, thank you.
Yeah, about the physical invisible agencies that he talks about, I actually thought about it some time back, that there are certain stereotypes which are invisible, but they kind of help you to identify these suspicions or these conspiracy theories. As in India, we have when the Nizamuddin Markaz case happened. So there is a physical, that is an invisible stereotype which kind of encourages these suspicions that, okay, if we blame a certain community, it is going to benefit it, or there are certain agencies who do it to corner them. So if you talk about physical invisible agencies, I think there are certain stereotypes, or there are certain things with respect to race, or when I was talking about the Northeastern people. So we corner them, we call them this because it's easier. It just doesn't arise from the fact that just being mongoloid makes them more susceptible to the coronavirus. But it's a kind of cornering them and then ask. It's an invisible agency where one corners them and then asks them that, okay, you could be spreading the virus. So in that sense, yeah, the stereotypes and the questions of racial tensions could be called as invisible agencies, according to me.
Thank you, Kashyapi, for that. And I think it's interesting that you mentioned the issue of stereotypes, because I'm also just thinking about the the relationship that that emerges between COVID-19, sort of the suspicion and xenophobia. So as we might be aware, when the coronavirus became popular, there's also that fear of particular groups of people, but especially the Chinese or the Japanese or Korean people, because there was generally a sense through xenophobic discourses that there are people that come from the regions where the virus started. But also in South Africa, just to note also the connection between this discourse of suspicion and xenophobia, because at some point when there's the borders, particularly the biggest, the busiest border, which is the Beitbridge Limpopo border post, when there were issues there in terms of traffic and getting people in and having people sleep there, on social media, particularly on Twitter, there were a lot of xenophobic comments that were stating that they should be, the foreigners or the Zimbabweans should be kept out because they pose a potential risk in terms of the transmission of the virus. So I'm also very interested in finding out if in any other context you found any of those important in terms of xenophobia, and how they relate to suspicion. But also before that can be spoken to, there's a question here from Diptarup, and it's a question for Kashyapi, and the question is, how valid do you feel are the conspiracy theories against the circulation of COVID-19 vaccines in India, given that the frontline workers were the first to receive the vaccines? Thank you for that question.
Yeah, thank you so much, Diptarup. So yeah, I would like to answer that by saying that yeah, there are certain levels of suspicion, and from the level of experts who have been studying immunology or things about vaccination. But there is also a counter question for that, where how many people have actually taken it of their own volition? They were frontline warriors, and in a way they were kind of forced to take the vaccination. And I know my uncle, he's working in the West Bengal Health Services, and he has also been in a way forced to take the injection. It's not like you're taking it out of your own volition. And whether these conspiracy theories are true or not is something it is something that we'll get to know as time progresses, as we see the impact of the virus or its efficacy. I think right now we cannot trash any of them, neither the conspiracy theories nor that the circulation of vaccines. So I think I hope that answers his question.
Thank you, Kashyapi. George or Columbus, any reflections to what has been discussed so far, or are you guys okay?
Yes, Kudzi. I found from Kashyapi's presentation the idea of discrimination on the basis of religion. Even though this is something that you would, I mean, when you look at it in hindsight, it's not surprising, but when it happens, it takes you by surprise. Only when you then think, oh, people always look at those that are different from them as being the reason for their troubles. We are always othering in society. So I found that quite intriguing, and I wouldn't be surprised if in other parts of the world that kind of phenomenon is surfaced, where a crisis arises or tragedy strikes, and instead of people looking at the real causes of the tragedy, they're quick to attribute it to those that are different from them. So for example, it could be women that are responsible, it could be foreigners that are responsible, or it could be, if we are Christian, it could be Muslims that are responsible. And I think it's a way in which as human beings, we look for quick solutions, and to problems. In other words, if we get rid of these Muslims, then the problem will be solved. Or if we get rid of these Christians, the problem will be solved. Or if we get rid of these foreigners, then the problem will be solved. And yet, if you do that, if the fundamental issues responsible for the problems have not been attended to, then the problems will continue to be there.
Indeed. Thank you so much, Doc. Columbus, do you have any input regarding what the presentations, or probably at this point out concluding remarks as well? You're on mute, Columbus.
Sorry, I was saying I'm okay. I think everything is flowing unless there is a direct question to me from anyone. Yeah.
All right. Thank you for that. I'd like to once again thank our wonderful group of panelists for facilitating this conversation. I think more than anything, what all the three of you have been able to do is to actually give us updates as well on the way things are, and also the situation in the different contexts within which you are located. Thank you very much for that. Are there any questions or housekeeping matters before I close off this webinar? Let me see, I have a message. Okay, perfect. Thank you so much for taking this time, and I wish you a good Easter ahead. Thank you so much, Columbus. Thank you, George. Thank you, Kashyapi. We look forward to having more engagements with you as a center. You guys have been wonderful. Goodbye, everyone.
Thank you so much. Thank you, everyone.
Thanks, Kudzi. Thanks, everyone.
Cheers.
Cheers.